3 breathing techniques can lower your blood pressure within minutes, and they require no medication, no equipment, and no getting out of your chair. The science behind them is genuinely fascinating. For anyone over 60, blood pressure probably isn't where you'd like it to be. More than 70% of adults past that age have hypertension. And here's what makes that frustrating. Even among people taking medication, fewer than half actually reach their target numbers. We clearly need every tool available. Nothing in this video replaces your doctor's advice or your prescribed medications, and I want that understood from the start. What I'm sharing today is something you can add to whatever treatment you're already on, something you can begin right now. Research confirms it actually works. A 2024 meta-analysis examined 15 randomized controlled trials with over 1,000 participants, and breathing exercises reduced systolic blood pressure by about 7 millimeters of mercury, according to that data. That reduction matches what you'd expect from regular aerobic exercise. Let's talk about what's actually happening inside your body when you change how you breathe. The science. Why breathing affects blood pressure. Your autonomic nervous system controls everything you don't consciously think about, including heart rate, digestion, and blood pressure. 2 branches make up this system. The sympathetic branch triggers your fight-or-flight response, making your heart beat faster, constricting your blood vessels, and pushing your blood pressure upward. The parasympathetic branch does the opposite by activating your rest and digest mode, which slows your heart, relaxes your blood vessels, and brings your blood pressure down. Your body activates that calming parasympathetic response primarily through the vagus nerve. And here's what matters. Slow, controlled breathing stimulates the vagus nerve directly. Respiratory sinus arrhythmia is the technical name for a fascinating phenomenon where your heart rate naturally decreases during exhalation. Extending your exhale, breathing out slowly and deliberately, sends a signal to your nervous system that it's time to calm down. But the story gets more interesting when you understand baroreflex sensitivity. Pressure sensors in your arteries detect blood pressure changes and trigger compensatory responses. But these sensors become less responsive as we age because arterial stiffening reduces their effectiveness. Researchers at the University of Milan discovered something remarkable about this. Slow breathing at 6 breaths per minute increased baroreflex sensitivity by 102% in hypertensive patients. That's not a minor improvement. That's essentially retraining your body's blood pressure regulation system. How fast do these effects actually occur? Japanese researchers found that 6 deep breaths alone can drop systolic blood pressure by about 8.6 millimeters of mercury, and a study in Frontiers in Physiology showed significant blood pressure reduction within just 2 minutes. These are real, measurable changes happening quickly. One caveat deserves attention here. Acute effects are temporary, meaning blood pressure typically returns to baseline within minutes to hours after you stop. Sustained benefits require regular daily practice, at least 15 minutes a day, continued for 4 to 8 weeks. That temporary reduction still matters though. Research in The Lancet found that a 5 millimeter of mercury reduction in systolic blood pressure correlates with a 10% lower risk of cardiovascular mortality. Every point counts. Time to get into the actual techniques. Technique number 1. Slow breathing at 6 breaths per minute. This technique has the strongest scientific evidence behind it, with multiple studies and multiple meta-analyses showing consistent results. Here's exactly what to do. Breathe at a rate of 6 breaths per minute, which means each complete breath, both in and out, takes about 10 seconds. The pattern works like this. Inhale for 4 to 5 seconds, then exhale for 5 to 6 seconds. Notice that the exhale runs slightly longer than the inhale, and that's intentional. Remember respiratory sinus arrhythmia? Extended exhalation activates your vagus nerve most effectively. 10 to 15 minutes per session works best, done daily or at minimum 3 to 4 times per week. 6 breaths per minute isn't an arbitrary number. That rate corresponds to what researchers call your body's resonant frequency, about 0.1 hertz, and at this rate your respiratory, cardiovascular, and baroreflex systems synchronize optimally. Think of it as finding the sweet spot where everything works together. Let me walk through it practically. Sit comfortably and close your eyes if you like. Breathe in slowly through your nose for a count of 4 or 5 while feeling your lungs fill. Now breathe out slowly through your mouth for a count of 5 or 6. Dr. Kimberly Parks, a cardiologist at Massachusetts General Hospital, Suggest pursing your lips like you re-blowing out candles on a birthday cake because this helps slow your exhalation. That's one breath, and you'll do about 6 of these per minute for 10 to 15 minutes. Some of you are probably thinking that 10 minutes feels like a long time to just sit and breathe. And you're right, it does take getting used to. But here's the thing, none of this is complicated. You can practice while watching television with the sound low, or sitting on your porch, or first thing in the morning, or right before bed. Research from 2017 examined 6 randomized controlled trials and found systolic blood pressure reductions exceeding 6 millimeters of mercury with this technique. That's a meaningful difference. Technique number 2, diaphragmatic breathing, or belly breathing. This technique builds on the same principles, but adds an important element by engaging your diaphragm, the large muscle sitting below your lungs. Here's how it works. Either lie down on your back or sit in a chair with your spine straight. Place one hand on your chest and the other on your belly, just below your ribs. That hand placement isn't decorative. It gives you real-time feedback about whether you're doing this correctly. Breathe in slowly through your nose and pay attention to this. Your belly should rise while your chest stays relatively still. You're breathing into your belly rather than your upper chest. Then exhale slowly through your mouth and feel your belly fall as air leaves. When your chest rises and falls, but your belly doesn't move much, you're doing what's called shallow chest breathing. Most of us default to that pattern, especially when stressed. Diaphragmatic breathing goes deeper and produces a more calming effect. A 2021 systematic review analyzed 13 studies on this technique and found that breathing at 6 breaths per minute or less for 10 minutes twice daily for 4 weeks effectively reduced blood pressure in prehypertensive and hypertensive adults. Strong evidence supports this approach. The technique combines slow breathing benefits with deeper diaphragm engagement, which amplifies vagus nerve stimulation. 10 minutes twice a day works best, and you should give it at least 4 weeks of consistent practice before expecting lasting changes. What I like about this technique is how it teaches awareness of your breathing throughout the day. Most of us breathe shallowly without realizing it, but once you get used to diaphragmatic breathing during practice sessions, you'll notice when you're breathing poorly at other times and can correct yourself. Technique number 3, alternate nostril breathing. This technique comes from the yoga tradition, where practitioners call it Nadi Shodhana, and while it might look unusual, solid research backs it up. A study at a major medical institute in India examined 170 hypertensive patients and found what researchers describe as a marked reduction in both systolic and diastolic blood pressure after just 5 days of practicing this technique for 10 minutes twice daily. The results reached high statistical significance. Here's the process. Sit comfortably with your spine straight and take your right hand to gently close your right nostril with your thumb. Breathe in slowly through your left nostril for about 4 seconds. Now close both nostrils briefly, just for a moment or two. Then release your right nostril, close the left one with your ring finger, and breathe out slowly through your right nostril for 4 to 8 seconds. Reverse the pattern next. Breathe in through that same right nostril, close both briefly, then exhale through the left. That completes one cycle, and you'll continue alternating for 10 to 15 minutes. I'll be honest with you. This one requires more coordination than the others, because you're reusing your fingers to control airflow while switching back and forth, and it can feel awkward at first. Many people find that the added focus required actually helps them reach a meditative state more easily. You're not just sitting there breathing. You're engaged in a task demanding your attention. A 2024 meta-analysis confirmed this technique's effectiveness for short-term blood pressure reduction, and researchers rated it as having moderate evidence, which is still quite good. Daily practice for 4 to 5 weeks produces the best results. What about those breathing patterns you've heard about? You may have encountered other techniques like 4-7-8 breathing or box breathing. Let me give you the honest picture of what the research shows. Dr. Andrew Weil popularized 4-7-8 breathing, where you breathe in for 4 seconds, hold for 7 seconds, and breathe out for 8 seconds. Many people find it helpful for sleep and relaxation, and it gets promoted widely for those purposes. When it comes specifically to blood pressure reduction, only one clinical study examined this technique, and participants were healthy young adults between 19 and 25, not seniors. Good evidence that it works for blood pressure in older adults simply doesn't exist yet. It might work, but confirmation is lacking. Box breathing, where you breathe in for 4 seconds, hold for 4, breathe out for 4, and hold for 4, is what the Navy SEALs use for acute stress management. For calming yourself in a stressful moment, it's excellent. A comparative study found that 6 breaths per minute slow breathing outperformed box breathing and improving heart rate variability. If lowering blood pressure is your specific goal, stick with the 3 techniques I've outlined because they have the strongest evidence for that particular purpose. A word about those breathing devices. Advertisements for devices like baroreflex, which is FDA cleared for adjunctive hypertension treatment, may have caught your attention. A sensor and headphones guide your breathing to a slower rate. The American Heart Association assigned device-guided breathing a Class IA, Level B recommendation back in 2013, meaning they consider it reasonable to perform. Some industry-sponsored trials showed impressive results, with systolic blood pressure dropping by 14 millimeters of mercury. The full picture deserves your attention, though. Independent researchers analyzed the data more carefully and found that removing the industry-sponsored studies left much smaller effects. A double-blind study published in JAMA Internal Medicine, where neither participants nor researchers knew who was using the real device versus a sham device, found no significant blood pressure difference between the 2 groups. What's interesting is that a meta-analysis found non-device slow breathing, which cost nothing, actually showed larger effects than device-guided breathing in some comparisons. Systolic blood pressure dropped by about 8.5 millimeters of mercury with free techniques versus about 5 millimeters with the device. The bottom line is that spending $200 or $300 on a device isn't necessary. The techniques I've taught you today are free, based on the same principles, and may actually work better. Safety. Important considerations for seniors. Some safety points need covering before you start practicing these techniques. Anyone with unstable heart conditions, a recent heart attack and arterial aneurysm, uncontrolled high blood pressure with systolic over 180, or recent surgery should talk to their doctor before starting any breathing exercises. Those with COPD, asthma, or other respiratory conditions need caution with any technique involving breath holds. Dr. Nai-Cheng Liang, an integrative pulmonologist at the University of California, San Diego, explains that some patients already have elevated carbon dioxide levels, and breath holding can temporarily increase that and become quite uncomfortable. Slow breathing and diaphragmatic techniques do involve breath holds and should be safer for most people with respiratory conditions, but checking with your doctor remains wise. Dizziness or lightheadedness during practice means you should slow your breathing down or stop temporarily. Your body is telling you to ease up, and that's normal when you're first starting out. Watch for hyperventilation symptoms, tingling sensations, racing heart, muscle cramping. Slow down immediately if these occur because you may be breathing too fast or too forcefully. Chest pain, feeling faint, or heart palpitations that don't resolve with rest mean you should stop and seek medical attention. Dr. Nai-Cheng Liang recommends starting with just 3 to 5 breath cycles at a time if you renew to this, then building up gradually from there. What the research can and cannot tell you, as complete honesty about what we know and what we don't know matters here. What research supports. Slow breathing can modestly reduce blood pressure, typically by 2 to 7 millimeters of mercury based on meta-analyses. The techniques appear safe with minimal side effects, and they can be helpful additions to medication and lifestyle changes. Some seniors with mild hypertension may find them particularly beneficial. What we read less certain about. Strong evidence on whether effects persist long-term after you stop practicing doesn't exist yet because most studies lasted 8 weeks or less. Research quality has limitations, and one meta-analysis noted that all 15 studies it reviewed had unclear or high risk of bias. Designing a true placebo for breathing exercises is difficult because participants know whether they re-breathing slowly or not. When researchers applied strict quality standards, one meta-analysis found that effects were not statistically significant. Appropriate caution in our claims is warranted. What this means for you. Don't throw away your blood pressure medication and don't expect miracles. But do consider adding breathing exercises to your daily routine as one more tool in your toolkit. Potential benefit is real, risk is minimal, and it costs nothing but a few minutes of your time. Putting IT into practice, how do you actually make this part of your life? My suggestion is to pick one technique to start with. For the strongest evidence, go with slow breathing at 6 breaths per minute because it's simple, well-researched, and effective. Find a time that works for you. Many people prefer first thing in the morning before the day gets busy, or in the evening as a way to wind down, and some do a session at each time. 5 to 10 minutes works fine if 15 feels like too much, and you can build up gradually from there. Consistency matters because research suggests you need at least 4 weeks of regular practice, ideally daily, to see sustained effects. This isn't a one-time fix, but rather an ongoing practice. Remember what Dr. Daniel Craighead, the researcher from the University of Colorado Boulder, said about similar breathing work. It's something you can do quickly in your home or office without having to change your clothes. Special equipment isn't necessary, and you don't need to go anywhere. A few minutes and your breath are all that's required. Conclusion. Let me bring this back to where we started. 70% of adults over 60 have high blood pressure, and fewer than half of those on medication achieve their target numbers. Every available tool matters. The 3 techniques I've shared today, slow breathing at 6 breaths per minute, diaphragmatic belly breathing, and alternate nostril breathing, are backed by real science. They work through clear physiological mechanisms by activating your vagus nerve, enhancing your baroreflex sensitivity, and shifting your nervous system toward a calmer state. Effects happen quickly, within seconds to minutes, but lasting benefits require consistent practice over weeks. None of this replaces medical care, but it is something you can do right now, today, for free, that may genuinely help. Dr. Kimberly Parks, the cardiologist from Harvard-affiliated Massachusetts General Hospital, put it this way: anyone with stage 1 hypertension should know that breathing exercises are an effective way to lower blood pressure without medication. Your breath stays with you every moment of every day, and learning to use it intentionally might be one of the best investments you make in your health. Thank you for watching, and take a deep breath.